The cuff has been mobilized and medial row anchors have been placed at the articular margin. The sutures have been passed, but not yet secured laterally. These are the anchors which I'm identifying prior to choosing the location for the EnFix. I'm using a punch to create a socket for the implant. The EnFix is made from demineralised cortical bone fibres, brought into the joint on its introducer through the anchor portal, just lateral to the edge of the acromion. The EnFix is now seated in its socket in the footprint. Next, the sutures will be retrieved and secured to lateral row anchors, which will bring the tendon over the EnFix.